Wisconsin's Department of Health Services has weighed in on the conversation happening nationally about changes to the federal budget, with Congress making decisions in the very near future about what that federal budget could look like, including any cuts or changes to Medicaid. Wisconsin's Department of Health Services has released a new analysis that tells the impact of any cuts to Medicaid on Wisconsin Medicaid members. Now remember, Medicaid has not yet been cut. These are just conversations that are continuing. But the Department of Health Services analysis is based on conversations coming out of the U.S. House of Representatives, which included instructions in their budget framework to cut $880 billion out of Medicaid. They want to know what that means for Wisconsin Medicaid members. Now remember, Wisconsin Medicaid goes by a number of different names, whether it's Badger Care Plus, Family Care, Iris, Katie Beckett, Family Care Partnership, the PACE program, or the Children's Long-Term Support Waiver Program. Medicaid and Badger Care Plus are the health coverage programs relied on by about 1 in 5 Wisconsinites, and that includes 40% of births being covered by Medicaid or Badger Care Plus programs, 38% of children being covered by one of those Medicaid programs, and 60% of people in nursing homes having Medicaid coverage. Badger Care is the state's largest Medicaid program with roughly 1 million members. It covers preventative care, urgent and emergency visits, vaccinations, prescriptions, and more. Now, in its analysis, the Wisconsin Department of Health Services analyzed 3 policy proposals and how those cuts to Medicaid might impact the people and providers in our state. Now, they don't know exactly what the House and the Senate are going to do, but they said if they were to institute something like per-person funding caps, this is what the consequence would be to Wisconsin. It would mean limited federal funding by setting a dollar amount for each enrollee. This would squeeze state budgets and leave taxpayers on the hook. It would mean cuts to benefits or cuts to provider payments. And Wisconsin could lose $16.8 billion in federal funding if this was the path the feds chose. They analyzed a different proposal, maybe Medicaid infrastructure cuts. They said Congress may cut the amount of federal money provided to states to support vital administrative functions like determining eligibility, reviewing claims, and paying providers. These changes would make it difficult to run Medicaid efficiently and effectively, says the analysis. It would also make it harder to eliminate fraud, waste, and abuse in the program. Now, that last policy proposal they evaluated would be barriers to coverage and increased cost, like making Medicaid members prove they are working to keep benefits. They say many Wisconsinites with Medicaid already work, and they're working at jobs that don't come with health insurance. Many others can't work because of their health condition. Congress may impose new red tape requirements, making it even harder for these folks to get health coverage. And if they do, they say you can count on 52,000 adults in Wisconsin losing their Medicaid. Wisconsin's Department of Health Services says the impact of federal budget cuts would be felt by both Medicaid members and providers in the state. Costs would be shifted to the state, the Medicaid budget overall would be slashed, services would be harder to access, and everyone, especially the Wisconsin taxpayer, would pay more. In a statement, the Wisconsin Medicaid Director Bill Hanna said, simply put, we can't have a healthy and strong Wisconsin without a healthy and strong Medicaid program. Massive cuts like those proposed by Congress would put our people, our healthcare system, and our economy at risk. You can read that full analysis from the Wisconsin Department of Health Services. We link to it in the description below.